I'm going to take you through the role of nutrition and lifestyle in cancer prevention. And my task has been made easier on two counts. Firstly, just a couple of months ago, the World Cancer Research Fund published their recommendations on cancer prevention. And there's no conflict. The 9 recommendations are everything we've been talking about today. And secondly, you've heard all of this before, but I'm going to just relate it to cancer. So what I'll hopefully take you through is how diet and lifestyle contributes to cancer development, how to reduce your risk of cancer, how to improve survival after a cancer diagnosis, and what are these 9 recommendations for cancer prevention. So cancer remains and is the top cause of premature death in the UK, accounting for 42% of cases of premature death. And 1 in 2 men and 1 in 3 females will develop cancer in their lifetime. And 50% of these cancers are accounted for by lung, breast, prostate and colon cancer. And I'll use these as examples as we go through. And we've heard over and over again today, it's not about genetics. Less than 10% of cancers are caused by our genes. And Cancer Research UK states that 40% of cases, if not more, are preventable through our lifestyle choices. So where have we gone wrong? These are my views on the issue. I think we continue to deny the evidence that we have in front of us and long for more robust information. But we have the information we need to make our lifestyle choices. We continue to emphasize research into the genetics of cancer, which will, in my view, only help the small number of patients at the end of their cancer journey with targeted treatments. We have separated diet and nutrition research into individual components, talking about fats and proteins and carbohydrates and sugars, when actually we should be talking about healthy dietary patterns because we eat food. We hope and continue to hope that supplements will compensate for our unhealthy diet. And there's not been a single study when it comes to cancer prevention that shows that a supplement is beneficial. We allow pharma to design and run our clinical trials because government and the NHS can't afford these expensive trials. And their motivation is simple. They want to make money out of us. And they're not going to design studies that show that you can prevent cancer. And lastly, we fail to apply a precautionary principle to nutrition. And I'll give you examples of this. But if a substance could be harmful to us, why don't we avoid it until we can confirm that it's okay to ingest? So when we're deciding about diet and nutrition and lifestyle, what sort of evidence are we looking for to convince ourselves that this whole food plant-based diet is the right one for cancer prevention? And here is listed the types of study we'd like to see. And I want to convince you that we have all of these studies when it comes to cancer prevention. We've got large studies in diverse populations showing what the healthful diet is. We've got laboratory studies going back over 15 years. An example here is that of a study that T. Colin Campbell performed in the laboratory, showing that casein, the main protein in milk, actually drives the growth of liver cancer cells. We know the mechanism by which our diet is creating and promoting cancers. And we even have randomized control studies showing that we can influence our risk of developing and surviving cancer. So this taking us back over 100 years. Oops, sorry. So on the left-hand side, you can see an article from Scientific America from 1892 saying that cancer is most frequent among those branches of human race where carnivorous habits prevail. And a short time later in the New York Times, 1907, cancer is increasing amongst meat eaters. On the other hand, Italians and Chinese, practically vegetarians, show the lowest mortality of all. And since that time, we've had study after study in large populations showing overall that those following a vegetarian diet, predominantly plant-based diet, have a significantly lower cancer incidence. In this study, it was 18% lower risk of cancer. And of course, we know it will reduce our risk of dying of heart disease. So this is from Cancer Research UK again, stating the main lifestyle factors that are associated with our rising prevalence of cancer. tobacco smoking, which we now are convinced by the data, but more importantly, our diet and our rising levels of obesity are going to overtake tobacco as the commonest cause of cancer. We need to be cautious about alcohol, we need sensible exposure to sun, and we need a minimum level of physical activity. And with all these lifestyle choices, we could prevent 40% of cases. So where do all these lifestyle factors fit into the phases of cancer development? Well, cancer develops in 3 main phases. Initiation is happening all the time. Every minute, every hour of the day, cells in our body are being damaged by toxins such as radiation, viruses, chemicals that we're ingesting. But our body has sophisticated mechanisms to control these abnormal cells, to prevent them growing, to cause death of these cells if we can't repair them. What takes much longer is this middle phase here called promotion, which takes years to decades to develop. And this is where we have the chance to make our bodies either develop cancer, so promote cancer, or we can treat our bodies in a way that can prevent the growth of these cells. And this final phase, which is a bit shorter, is where the cancer has spread beyond the initial site, and we find it very difficult to control. So how does diet and lifestyle influence cancer development? So as I've said already, obesity is going to overtake tobacco as the commonest cause of cancer. And at the moment, well, 2015, 7 out of 10 of us are overweight and 3 out of 10 of us were obese. And this is predicted to increase in the next decade or so. And being overweight has been associated with 13 different cancers, some of our commonest cancers like breast and bowel cancer, but also the more rarer cancers that are more difficult to treat, like esophageal and pancreatic cancer. And we've seen this slide before. It's from the Seventh-day Adventist study, but it shows nicely that predominantly plant-based eaters are the thinnest, they're the lightest, and the most likely to remain within the normal recommended BMI. So how does obesity lead to cancer? The fat cells that deposit under the skin and around our organs lead to an increased production of estrogen, which drives the hormone-driven cancers such as breast, endometrial, and ovarian cancer. The fat cells produce insulin and insulin-like growth factors, which also stimulates the growth of cells. And obesity in general is an inflammatory state. Your body is under a state of stress, and this stress of inflammation releases chemicals and cytokines that also stimulate the growth of cancer. And obesity leads to an increased risk of chronic disease. And chronic diseases here shown on the left-hand side, such as lung disease, kidney, heart disease, and diabetes, has been shown to contribute to over 1/3 of the risk of dying from cancer. And this study was just published earlier this year, following over 400,000 Taiwanese people over 8 years, showing that chronic disease is linked to cancer. And I've already said that lifestyle factors are also contributing to our increased prevalence and morbidity from cancer. And overall, if you have all of these factors stated, you shorten your life expectancy by 15 years. So back to our diet. Although I don't like separating diet into individual components, this is how some of the studies have been done. And when it comes to animal foods, we have known since the 1980s that animal fat, which is the saturated fat, is directly correlated with rising rates of cancer. And here, this is correlated with the chances of dying from breast cancer. But when you look at plant fats, you can't draw a straight line through this. Plant fats have not been associated with increased risk of cancer. And since that time, we've shown that higher intakes of saturated fat, so animal fats, increase the risk of breast cancer, aggressive prostate cancer, and interestingly, even in smokers, those that are eating a diet higher in saturated fats increases their risk of getting lung cancer. And of course, you can't talk about saturated fat without talking about animal protein. And this study followed more than 7,000 Americans for over 18 years. What it showed was that those eating a diet of more than 20% protein, particularly from animals, had a 4 times increased risk of death from cancer. And I'll come back to the reasons why, but it particularly noted it was due to a higher level of IGF-1, insulin-like growth factor, in the predominantly meat eaters. And Shandeep already showed this, but we know from the WHO report in 2015 that processed meat has been classed as a group 1 carcinogen. It causes cancer, and red meat is a probable cause of cancer. And this is where I come back to the precautionary principle. We may not be able to say for certain about red meats causing cancer, but what we know is it's not essential in the diet, and even if it possibly causes cancer, it's worth avoiding. And what are the reasons why meat, and particularly processed and red meat, are carcinogenic? So why do they cause cancer? Well, heme iron is becoming a top culprit. Within the gut, the iron from heme is converted into N-nitroso compounds by the bacteria, and these are carcinogens. Heme iron also creates an oxidative environment. We saw the rusty nail. It causes that in our body, which directly damages the cells. Processed meats are preserved with nitrates and nitrites, which are again converted into N-nitroso compounds, which are carcinogens. Just cooking the flesh of animals, so skeletal muscle when it's heated, or skeletal muscle when it's heated, produces cancer-causing chemicals, so heterocyclic amines and polycyclic aromatic hydrocarbons. And interestingly, poultry creates more of these chemicals than red meats. And of course, meat is devoid of all the nutrients we know are important in preventing cancer, so fiber, antioxidants, and phytochemicals. And it's not all about animal foods. It's about the quality of our diet, and the quality of a plant-based diet is really important. And this is one of the first studies just published earlier this year that followed over 100,000 people in France and showed that a 10% increase in the proportion of ultra-processed foods in the diet, so processed foods, can increase the risk of dying of cancer by 10% as well. So this is overall cancer, and there's a particularly increased risk of breast cancer. And we've covered a little bit about dairy, and there's been a bit of mixed data about dairy. And in the World Cancer Research Fund recommendations, it does state that dairy is protective against colorectal cancer. But when you read a little bit further into this, the reason is that the calcium in dairy can mitigate some of the bad effects of the heme iron in the gut. So yes, eat your heme iron, but if you're trying to reduce your risk, have some dairy as well. And actually calcium supplements have a similar effect. So it doesn't quite make sense to me to eat a carcinogen on the one hand and counteract it with the dairy. But with other cancers, particularly the hormone-driven cancers, breast cancer, ovarian cancer, prostate cancer, dairy has been implicated strongly in the rising incidence. And this is most clearly shown with prostate cancer. The EPIC study, European Prospective Investigation into Cancer and Nutrition, which followed more than 500,000 people in 10 different European countries, showed that those consuming dairy, those men consuming dairy, had a 22% increased risk of prostate cancer, and a 35 gram a day of dairy protein increased the risk by 32%. And this is about 100 grams of cheese. So we come on to the mechanisms, and one of the fundamental mechanisms by which our diet increases our risk of cancer is through IGF-1, insulin-like growth factor. And we know it's important because of some studies performed in a group of individuals with a rare form of dwarfism called Laron syndrome. They have a mutation in the growth factor receptor gene by which they have very low levels of IGF-1, and these people have very, very low, if virtually non-existent, incidence of cancer despite being overweight. And we know you can alter your levels of IGF-1 in the blood very easily through your diet choices. So here on the left, you can see those following a plant-based diet have the lowest levels of IGF-1, lower than a calorie-restricted diet and much lower than your standard Western diet. And we can alter our level of IGF-1 within a few days. So this study took place over just 11 days when overweight, middle-aged men were put on a whole food plant-based diet and asked to exercise. And within 11 days, there was a significant reduction in IGF-1 levels. And in the longer term, this was even more pronounced. The other mechanism by which diet contributes to cancer development has already been touched upon, but estrogen, which is really important in driving breast cancer and endometrial cancer, the levels in our blood are very much affected by what we eat. And this study is taken from work from T. Colin Campbell and the researchers of the China study, which compared rural Chinese people eating predominantly plant-based diets with age-matched women in Britain at the time, and showed that those on a plant-based diet had much lower levels of estrogen over their lifetime compared with the more meat-based diets. And as Shandeep has already said, the median age of menarche in China at the time was 17 compared to the low level of 13 years in British girls at the time. And then we come back again to the precautionary principle. Viruses cause cancer. So in humans, HIV, HTLV1, hepatitis B, hepatitis C, they all cause cancer. We know that animal viruses cause cancer. So for example, in poultry slaughterhouse workers, these individuals who are killing chickens day in, day out, have a 9 times increased risk of liver cancer and pancreatic cancer. And it's thought to be due to the transmission of a poultry wart virus. So we have precedents for this. And this is a study looking at bovine leukemia virus. So it's got a self-explanatory name. It's found in cows. It causes leukemia in cows. And it can be transmitted to humans. Now, this isn't particularly a UK problem because our cows don't have bovine leukemia virus. But if you're traveling anywhere else, it's highly endemic in America, for example. And when they looked at breast tissue taken from individuals having an operation, they looked at normal breast tissue, precancerous breast tissue, and actual cancer. And what they found was that in up to 60% of cancerous breast tissue, they found evidence of a bovine leukemia virus. Now, of course, this doesn't show cause and effect, but we've got to wonder what a bovine cancer virus is doing in our body cells. So, some more bad news, I'm afraid. The Journal of Clinical Oncology have written a position statement telling us that alcohol is a carcinogen. That's the bottom line. And although there is a dose effect, there is no minimum amount that is safe that will not alter or increase your risk of cancer. And it causes 7 different types of cancer that you can see here. Some of our commonest ones: bowels, breast, again, esophageal, mouth and upper throat, and larynx. So really, if you're trying to prevent cancer, it's best avoided. So I think you've probably got the gist of this already, but what do we need to do to prevent cancer? We need to be eating these 4 main food groups: fruits, vegetables, whole grains, and legumes. And we've known for decades that the fibre is core to the components of this diet that are preventing cancer. And Dennis Burkitt clearly was ahead of his time. He noted when he was doing missionary work in rural Africa that when he looked at the diet of the Africans, those eating little processed food, mainly plants, eating loads of fibre, virtually never got bowel cancers. But as the Africans moved their diet to more processed foods and more animal products, this led to an increased risk of cancer. And since that time, we've had study after study that's shown that if you double your fibre intake from 20 grams a day to 40 grams a day, you halve the incidence of colon cancer. And most of us aren't even reaching a minimum of 15 grams a day. Whole grains are rich in fibre, but they're also rich in phytates, which have cancer-preventing properties. And again, the World Cancer Research Fund has stated that consuming whole grains probably protects against colorectal cancer. Beans are integral to the diet that we're all recommending for cancer prevention. They're rich in fibre and also phytates. And the Predimed study, which has also been mentioned earlier today, it was a study looking at the effects of a Mediterranean diet on cardiovascular incidence and mortality. But one of the sub-studies showed that those individuals that were eating beans had a reduced mortality from cancer by 35%. And soya beans have been mentioned already. There's no controversy, just inaccurate information. Soya beans are healthy and in particular have a positive impact on your risk of getting and surviving breast cancer, but also prostate cancer. And this study is a meta-analysis of 18 studies showing just that soya consumption reduces the risk of getting breast cancer, particularly the consumption in adolescents, but also the risk of it coming back after treatment. Fruits and vegetables have been shown to reduce our risk of cancer, and this was a meta-analysis of 95 different studies showing that as you increase the intake of fruit and vegetables to 800 grams a day, just by eating these food groups, you can reduce your incidence of cancer or incidence of dying of cancer by up to 15%. And this really means an intake of up to 10 portions of fruit and vegetables a day. And the great vegetables for cancer prevention are those with lycopene, so the red-coloured fruits and vegetables, cruciferous vegetables, which are top of the class and that are rich in thiocyanates, berries, again, great for cancer prevention because high in antioxidants and phytochemicals, and the allium group of vegetables, the onions, the garlic, the leeks, are rich in organosulfur compounds. And we actually know how cruciferous vegetables work in the body. The stomach acid breaks down the indole compound into a receptor on the lymphocyte. So this receptor ligand binds to aryl hydrocarbon and activates the receptor to go into the nucleus and stimulate the function and the immune function of lymphocytes in the gut. So it really is never too late. Even if you've had a cancer diagnosis, you can make a positive impact on your chances of surviving cancer by changing to a whole food plant-based diet. So this is a seminal bit of work by Dean Ornish and colleagues in America. He randomized 93 men with early prostate cancer and put half of them into a lifestyle group where they were put onto a whole food plant-based diet, exercise program and stress relieving activities, and the other half in blue carried on their normal life. And after a year, there was a significant reduction in the lifestyle intervention group of the PSA level, that's the prostate specific antigen that's a marker of prostate cancer growth. And after 2 years, the control group that didn't change their lifestyle had a 27% chance of going on to receive conventional cancer treatment such as surgery and radiation, whereas only 5% of the lifestyle intervention group required further treatment for their cancer. And when he took the blood of these individuals on the lifestyle program and dripped it over the cells of prostate cancer cells in the laboratory, before the start of the intervention, the blood could only inhibit the growth of prostate cancer cells by 9%, but after a year, the blood of these individuals could reduce the growth of prostate cancer cells in the laboratory by 70%. And similar interventions have been done regarding breast cancer, and this is data taken from the Women's Health Initiative study, which randomized over 100,000 women with postmenopausal women, actually. They were well at the time, but they randomized them to a low-fat dietary pattern and emphasized fruits, vegetables and whole grains in the intervention group and compared them to a group that didn't change their diet. And in those that did develop breast cancer, those that were on the low-fat diet had increased and improved survival after the diagnosis and had reduced chances of death dying from breast cancer, other cancers as well, and also from heart disease. And this was just published a couple of months ago. The other really healthful components of the diet which have been shown to prevent and reduce our risk of cancer are spices, and curcumin, found in turmeric, really is the queen of cancer prevention. There have been randomized studies in myeloma, and there have been intervention studies in colonic polyps and oral cancers. Flax seeds have been shown to reduce the progression of prostate cancer growth and also breast cancer growth. They're rich in a precursor of lignans, which is a phytoestrogen. And those eating regular nuts also have reduced incidence of cancer. And this is just a busy diagram, but just shows that food can act to all different aspects of cancer development, the initiation, progression, and the promotion, and really acting on inhibiting cell growth, inhibiting blood vessel formation, reducing inflammation. So when it comes to healthful drinks, the data is supportive of green tea, which is high in the polyphenol EGCG, and there have been some really encouraging studies done in chronic lymphocytic leukemia, and showing that it can reduce the rate of progression. And for cancer prevention, coffee is definitely not harmful and may be beneficial for certain cancer types such as liver and esophageal cancer. And again, green tea has been shown in the laboratory to prevent initiation, promotion, and progression of cancer. The other really important lifestyle choice that you can make is to do regular exercise, as this has been associated with reduced risk of at least 13 different cancers. And there's a variety of mechanisms. It helps maintain a healthful weight. There's reduced insulin resistance, lower levels of IGF-1 and insulin, lower levels of estrogen, lower inflammation, enhanced immune function, and overall it also reduces your risk of cancer recurrence after a diagnosis. So I've hopefully summarised what was just published a couple of months ago about the 9 recommendations for cancer prevention, and I don't think anything we're talking about today conflicts with this. So be a healthful weight, be physically active, eat a diet rich in whole grains, vegetables, fruits and beans, limit consumption of fast food, limit red and processed meat, limit sugar and sweetened drinks, and this is mainly due to its association with obesity. Limit alcohol consumption. Do not use supplements, because there really are not any data to support supplementation for cancer prevention. And what I haven't said, but it is clear from Shandeep's talk, that for mothers, breastfeeding can reduce their personal incidence of breast cancer, but also has overwhelming benefits for the baby. So hopefully I summarised for you that a large proportion of cancers are preventable through healthy lifestyle choices. Diet and lifestyle is contributing to our high rates of cancer incidence, and a healthy diet and lifestyle can reduce our risk of getting cancer, but importantly can reduce our risk of dying after a cancer diagnosis. So I will just leave you with this quote, and thank you very much.